I'm Peter Block in Orlando at the AHA annual meeting, and the SPRINT trial has taken front row seating in terms of its outcomes, showing that lowering blood pressure actually improves outcomes. So with me is Martha Gulati from the ACC and CardioSmart. Martha, welcome. I want to talk to you a little bit about sharing the whole decision-making process, decision sharing, if you will, with your doctor, and what patients can learn from this trial as well as physicians. So tell me a little bit about your take on SPRINT and how you want to play this one in terms of educating people.
Sure. I think the thing about SPRINT is we're finding, and we've known this, that blood pressure control is important. It's going to reduce cardiovascular events. It's going to reduce mortality. We already know in the United States we don't do a great job at controlling blood pressure, even with the current guidelines. Our current numbers of saying achieve a systolic blood pressure under 140. Only about 50% of Americans even get to that goal. This SPRINT trial showed that even getting the blood pressure lower for certain people improved their outcomes. And I think what patients need to know is that if they fit the criteria for the SPRINT trial, which only a percentage of the United States folks will fit the criteria, but if they fit it, maybe lower's better. But let's first get blood pressure controlled. I think that's what we're really struggling with. So from a shared decision-making point of view, I think patients need to know, what is the numbers I'm trying to achieve? How should we do this? Does this mean additional medication? Does it mean monitoring blood pressure at home? And when do I take my medications? How do I take my medications? And am I getting to where the physician wants me to get to?
Okay, so let me interrupt, because I think your points are all well taken. I just want to point out, and you know this as well as I do, that over the last few years there's been this sort of hopscotching. People have said, well, maybe low blood pressure isn't so good. Maybe it should be higher than we thought. And now suddenly we're back to get it as low as possible once again. Your take on it?
Well, in the previous trials that showed that lower might not be as safer, particularly in elderly patients, I think, they were including people who had a stroke or had diabetes. This study, we must emphasize, did not include anybody who had a stroke, did not include anybody who had diabetes. And I think for the people that have that, they have to understand that the SPRINT trial results do not apply to them. This study, though, in the numbers, they had more numbers, they had more diversity, both in terms of race and even in terms of gender. So I think they can be more broadly applied than prior trials, but they also can only be applied to the people we studied.
Okay, so we're really talking about shared decision making. So let's get back to that. This is about patients understanding if they might be helped by this trial, and also physicians understanding if their patients can be helped. So what's the clinical sort of final take-home message here that you would like to send out to everybody that's watching?
I think the most important thing is make sure your blood pressure is controlled. Take your medications as your physician advises you, and know what the goal is for you personally. We have to personalize and individualize what everyone's target is. There's no number for one person that's the same for another, and that's what we're finding out.
And I would add to that, for patients that are out there, take your blood pressure at home, right?
Absolutely.
Take it at the local CVS or wherever you can get it, just to find out what it really is when you're walking around. Try to get it as low as possible, and maybe you'll do better.
Absolutely.
Thanks very much.